To be part of this incredibly exciting event today. Today, we unveil our statewide protocol in response to the commercial sexual exploitation of our children. According to the National Center on Missing and Exploited Children, there are currently between 100 and 300,000 children being sold for sex in the United States. Commercial sexual exploitation is a $99 billion a year industry. And just to put that in perspective, Apple, a company that reports higher annual profits than any other Fortune 500 company, had net earnings of $39.5 billion last year. 39.5 versus 99. Estimates are that a child sex trafficker can make $650,000 a year exploiting 4 children. In Rhode Island, we are now getting a realistic picture of this problem. In the last few months, since rolling out our CSEC program, our team has had over 30 victim referrals, averaging 15 years old. They are girls, boys, transgender youth. They are our kids, and they are in every community in Rhode Island. Today, we begin a call to action to bring an end to this epidemic. These protocols represent so much more than the document you're holding today. They are a guide for everyone. For law enforcement, educators, child protection, health professionals, they are a guide for what to look for, what questions to ask, who to call, and how to help. There are so many people involved with getting us to today. Most importantly, the amazing members of the Rhode Island Human Trafficking Task Force, who, for the past 2 years, have been the most dedicated, productive, collaborative group you could ever work with, representing child protection, law enforcement, human services, prosecution, advocacy, medical. Can I ask all of the task force members who are here to stand and be recognized? So before I introduce our speakers, there are some guests I'd like to acknowledge. And these individuals are being acknowledged because they've also played a role in addressing this issue, providing leadership, dedicating staff, and really getting in the trenches with all of us to move this issue forward. Retired Chief Justice of the Rhode Island Family Court, Haiganush Bedrosian, I believe she's here. 2 years ago, Judge Bedrosian hosted, I think, one of the largest conferences ever in the state of Rhode Island, and it was during a snowstorm, if I recall, 2 days. And it was an amazing conference on exactly this topic, commercial sexual exploitation of children. Judge Bedrosian had the experts in New England and beyond, and we spent 2 days really steeped in all that there was at that time to learn about sex trafficking. And it was phenomenal. It gave a real boost to the task force, and we are forever grateful for your leadership in providing that forum for all of us. I'd also like to welcome Acting Chief Judge of the Rhode Island Family Court, Michael Forte, who's here with us today. First Assistant U.S. Attorney Stephen Danbrook, and representing the U.S. Attorney's Office, who have dedicated countless hours and staff to working on this initiative. Jamie McDonald, Chief Strategy Officer for the Executive Office of Health and Human Services. You've got to do something about that title. Who oversees DCYF and has provided the same kind of support with staff and countless hours, energy, and working toward developing where we are today. Rhode Island State Police Detective Heather Donahue. Where are you, Heather? Representing the state police, who again have also been so hard at work with us. Commander Thomas Oates, Deputy Chief, Providence Police. And representing so many law enforcement members of Providence Police Department who have really, we could not have accomplished this without your dedication and your team. Susan Goldfarb and Beth Bouchard, are you here? No? I'll just acknowledge them. They were to be here. They come from the Suffolk County Children's Advocacy Center, and they were our mentors. We used them. They were our consultants. As we developed this process, we could not have stayed on task without them. Wouldn't you all agree? I think that's, yeah. And also our funders. Some of you are here today, but I don't want to leave anyone out. Rhode Island Foundation, the State of Rhode Island, Victims of Crime Act, and private donors. You know who you are. And again, we couldn't do it without you. I'd also like to welcome, and I hope I don't leave anyone out, Rep. Mia Ackerman is here, Representative Doreen Costa, and I'm sorry?
Rep. Clancy.
Rep. Clancy. Welcome. Okay. So today you will hear from Governor Gina Raimondo, Senator Teresa Paiva Weed, Dr. Christine Barron from the Auburn Center at Hasbro Hospital, Children's Hospital, and Danielle Openhouse, Trafficking Survivor and Mentor Coordinator at Day One. I just love saying that. So great that we have you now. We just heard that Attorney General Peter Kilmartin and Speaker Nicholas Mattiello were called out at the last minute. They were scheduled to be here to address you and are very committed to this issue as well. So, before she was elected, Governor Raimondo met with staff at Day One and expressed her commitment to addressing the issue of sex trafficking. I know it's an issue she cares deeply about, and we look forward to her continued leadership as we move forward to address the policy and legislative changes that are needed. And I know the governor is very committed to that initiative. It's my honor to introduce Governor Gina Raimondo.
Thank you. Thank you, Peg. I appreciate that. Thank you, Peg. I appreciate that. And thank you all for being here. I know we're all busy and have competing priorities, but this is important, and this is about as important of a thing that we could be doing today, and I appreciate you all being here. And special thanks to the Senate President for her leadership on this issue and for being here, and for the representatives that are here. Thank you all for coming. And to the members of the State Police who are here, thank you. Good morning. I have enjoyed working with you, Peg, since I've been treasurer. We worked together to revamp and fix the Crime Victims Compensation Program, made that program stronger, make sure that that program takes care of victims, and that is working. I remember Judge Bedrosian's conference very well. It was a snowy, busy day, and it was a great pleasure for me to be there then. Because the reality is we have a problem. We have a problem. We have a serious problem with human trafficking, and we have to do more. And the reason we're here is because we're committing ourselves to doing more. Because these are our daughters and our friends and people in our community, and we owe them a Rhode Island where they can be safe and secure. And that's what this is all about. And that's what you're working day in and day out to do, and you have my full support. And we're just going to keep going in the face of ever-increasing challenges. And I just have to make sure these people are treated like victims and not like criminals, which is what they are, and make sure that we have a total coordinated effort. You mentioned DCYF. I'm so proud of the work Jamie is doing. We need a coordinated effort from public safety, from the Attorney General, with the legislature, with Day One, with the governor's office, with the directors, with the family court. We're all in the boat to make Rhode Island safer and more secure. And that's why I issued a policy directive in July calling on our state agencies to develop an action plan to address human trafficking in Rhode Island. That was an important step forward to say everybody come together on the same page moving forward. And again, I'm so pleased with the work that Jamie and DCYF are doing in partnership with the State Police Violent Fugitive Task Force and the Fusion Center. We're collaborating to track and locate children who are most at risk for human trafficking, such as those who've run away from foster homes. the most vulnerable among us, first in a foster home, then running away, then falling into human trafficking. It's a big deal. Today's a big deal, and I congratulate you for all of your work. For the first time, Rhode Island will have a coordinated, streamlined approach to respond to and report cases of human trafficking, specifically and especially involving children. It's a major step forward in the work that Day One and others, have been working on for a long time. So the truth of it is, sex trafficking can and does take place in any community. And so we just today first have to thank you for your hard work and thank the Senate and the House and my directors and state police for working on this, to celebrate what you're doing, and then just to recommit ourselves again today to continue to work until we can say all children and young people are safe in Rhode Island and parents and others don't have to worry about sex trafficking taking away their kids. So I'm in. I support you. I admire your work, and let's move forward together.
Thank you.
Hi, I can introduce myself. Teresa Paiva Weed, President of the Senate, and certainly a friend and supporter of Day One. I want to recognize my colleagues from the House and kind of begin where I'm going to end with, I hope that you know that you have the support of both chambers with any legislative changes that are needed for the protocols. Governor Raimondo has been a leader on this and many issues. And her staff, Jamie McDonald and DCYF, are critical to the success of this initiative. I, too, want to recognize the role that the state police and the Providence police have played in the development of these protocols, as well as Hasbro Children's Hospital and Dr. Barron, Dr. Christine Barron. I know later we're going to also hear from a trafficking survivor, Danielle, and a mentor coordinator at Day One, and we look forward to hearing from you. I am happy to be here today, and it is important to support the work of Day One, but it's also one of those opportunities where we recognize our partners at the state, federal, and local law enforcement, the state social service agencies, and health professionals, as we see that a multidisciplinary approach is developed to address this growing problem, not just in Rhode Island, but in New England. The collaboration and leadership among all of you has provided the basis for this statewide protocol. It will serve as a resource for victims advocates, social service providers, healthcare providers, law enforcement, and prosecutors. This protocol will guide each and every one of them as they detect and investigate trafficking, how they prosecute crimes, and assist victims in their recovery. As the governor stated, this is an issue which has only recently had individuals comfortable with coming forward, and I too would recognize Judge Forte and Judge Bedrosian's conference with talking about this. If we are to combat the commercial sexual exploitation of our children, education, awareness, and training are critical. The streamlined approach that we're going to hear about today, combined with the efforts of the Rhode Island Human Trafficking Task Force, will give our state an upper hand in addressing this issue. In fact, the work that the task force has done has already led to the identification of more victims, and I expect this to only grow with the implementation of the protocol. We are here to support the efforts that you've made, and I do believe that this protocol will go a long way towards protecting our children. And I look forward to continuing to work together with you to protect our children, our daughters, granddaughters, friends, neighbors, and make our communities safer. It is an issue that often escapes the public conscience because it's not easy to talk about. But I, too, want to echo the governor's sentiment that these are all of our children, and thank you for the work you do every day to protect them and make them safer. Thank you.
Good morning. Thank you very much for your words of kindness after all the work that we have been doing. It's been an amazing process. As many of you know, I'm Dr. Christine Barron. I am a child abuse pediatrician from the Aubin Center at Hasbro Children's Hospital. The Aubin Center is a program where we complete very comprehensive medical evaluations for infants, children, and adolescents for all forms of child abuse and neglect. So it obviously was an easy connection then to make our way into working with Day One and the Rhode Island Human Trafficking Task Force. Dr. Goldberg could not be here today, but both her and I have been involved in the task force since its inception, and we have worked with many of you in many processes and multidisciplinary programs, and I have to say this is a really dedicated group. They have worked very, very hard, and we continue our work together. Dr. Goldberg and I have provided the medical piece, and Dr. Goldberg was instrumental in creating the protocol, and so I'm sorry she couldn't be here, but she's in San Diego, and I'm sure enjoying a little bit of weather. It's a little bit nicer than ours. I will say I thank, again, Day One for actually helping us create this task force, and everyone across the state who have worked with the task force members to get us to where we are. As a physician, I have to say I really appreciate that Hasbro Children's Hospital, the Department of Peds, the administration, and VOCA have provided support to us for the work that we do. As a physician, I'm in a different position than many other folks, but work with all of law enforcement on the local and state and federal level, and have to say that we always want to provide the best medical care. And even as a child abuse pediatrician, I didn't recognize children that were victims of sex trafficking initially. So I think that if I look back now, I can absolutely identify some kids who I evaluated, but they themselves don't always identify to us as victims. And so my component in the medical piece of this is to really have us looking at how can we do a better job in every venue, including medical. So since we started this, the Aubin Center has actually completed evaluations on almost 60 children who have either been identified definitely as victims or high-risk improbable victims. Many of you out in the audience have actually worked with us on those cases, and I appreciate all of the work that you've done. The hard part is that even nationally, there's not a medical protocol for what to do from a medical standpoint of view when children are identified. And many, as I said, are not identified. On the only national protocol we have so far, it actually says assess medical needs and treat, which really I have to say when I'm in a clinic, it really doesn't help me very much. So I have to figure out what to do. And through our work, through this task force, both Dr. Goldberg and I have been working in Rhode Island and nationally to then create medical protocols for the actual identification, the actual treatment and follow-up medical care for these victims, as well as continued cooperation and collaboration with law enforcement and prosecutors. I have to say, sadly, this crime preys on the developmental vulnerabilities of adolescents. And truly, there are high-risk adolescents, but all adolescents in our state are at risk. And therefore, we also need to continue to work through our Rhode Island prevention programs. And we have been very fortunate in many of our venues to actually work and start work on prevention. Because while we want to prevent any victim, the time and energy and effort it will take towards preventing one victim is well worth it. I would certainly like to stand before you this morning to tell you that despite how sobering this subject is, I stand before you hopeful, because I know of all the hard work that has gone into this, and I recognize that the work that has already been done will actually be a strong foundation upon which all of us in our multidisciplines will continue to work together, because we need to improve the identification, the intervention, and the prevention of sex trafficking for our children. And I thank you today for having the opportunity to share this with you.
Hi, my name is Danielle Openhouse. I'm the Survivor Mentor Coordinator for Day One. And as I stand here before all of you, I may seem no different than the rest of you. We all faced problems growing up, and we didn't know how to face our problems. A lot of us have wanted to run away at one point or another, and that's exactly how I felt. I ran away, and I ran right into a man who promised to love me and give me everything that would solve all the problems I had. This man broke me in every sense of the word. He destroyed my view of men and my way of life forever. I was fortunate enough to escape my pimp's hands, but I was left with scars that no one could fix. No one understood what I had gone through, so I felt I hadn't received help that people didn't know how to help me. They didn't understand what I went through. I felt alone. And like many people, I wondered why this had happened to me, but I never thought it could. All across the board, it is so hard to get out. Not only is the illusion of money a hindrance, but the distorted psychology of each survivor. From a distorted definition of love to recurrent flashbacks, panic attacks, and other psychological disorders. I can say you can never actually leave what you've gone through behind, but if you have the determination to want more for yourself and the resilience to become a better person, you can. That was my journey before it led me to my position at Day One and its mentoring program. This survivor-led model, which pairs girls in the life with those who have come out on the other side and understand what they have gone through, has proven to be the most successful and effective way to reach victims of trafficking. I know what I went through is so I could provide quality care from personal experience. I know what these girls have gone through, and I have the professional training to help them. And that has always been the answer to why I've gone through this. I am proudly one of very few people who have gone through this trauma and come out on the successful end. And I plan to share that with the rest of the girls. You can never fully get over something like this, but I know the process to recovery all too well. I understand the trials these victims have gone through, and therefore know they should be treated as the victims that they are. I am thankful I was able to escape and become the person I am now. I look forward to making a difference in the fight against commercial sexual exploitation. Thank you.
Thank you, Danielle. And thanks to all of our speakers today. Governor Raimondo, Senate President Teresa Paiva Weed, Christine Barron, your words and your dedication and leadership are so important to us, and we can't continue to do this work without you. So today is a milestone, but it's only the beginning. Our focus now is going to be on statewide training, rolling out a screening tool to better identify victims. We're looking at that, working closely with DCYF on that, and promoting awareness and understanding among all community members. That's all of you. So we need you. There are flyers, you may have them by now, there are flyers that outline the locations and dates for our first community forums. We're going to be holding them around the state. And you can also look on Day One's online calendar to see, if any dates change or locations. So I hope you leave here today with a little better understanding of what CSEC is, its effect on our community as a whole. Again, as everyone today has said, these are our kids. It's up to all of us to put an end to this. Thank you all for coming. I'd just like to acknowledge Homeland Security as well. I feel like I mentioned a lot of different law enforcement entities, and they're here as a team, and they are such an amazing... I never knew what they did until they got involved with this task force, and now they're just awesome. So.